My job interview is in a few days and I'm so nervous. What should I do? I just watch videos on how to ace an interview.
Graduating from a healthcare program is truly exciting and a big accomplishment in a person's life. A big chapter of your life is ended, which means that a new and fresh chapter is about to start. It also means that you need to prepare for another difficult phase in your life, and that is the interview. This is why I'm here to give you several tips on how to ace your first interview. Before the interview, tip number 1. Dress like the medical professional you want to be. It's often true that the first impressions matter a lot, but in healthcare job interviews, when you only have a few minutes to secure a job, every impression matters. The way you dress truly makes a statement about you and an impression about your professionalism. The way you dress communicates two big things to the interview: how you compose yourself professionally and how seriously you take the work. Remember that you are a professional who is about to take her first step in getting a job. Are you going to be interviewed as well? Tip number 2. Show on time or a bit early. Show to your potential employer that you are not tardy. Allow some time for the traffic, possible misdirections, parking issues, and more. Always try to think that your interview is 30 minutes to 1 hour early. Show some courtesy. It is better for you to be a little early than to make your potential employer wait. Tip number 3. Show up fresh. The way you present yourself can also make a statement on how your potential employer sees you as a responsible employee. During the interview, tip number 1. Communicate why you want to work there. Every hospital, doctor's office, and lab is unique, often with its own specialty or advantages. Decide for yourself why you want to work at this particular place and prepare to articulate that, either directly or offhandedly. Demonstrate that you've researched the clinic in advance and believe yourself especially qualified to work there.
Your facility has one of the top recruiting cardiac units in the country, and I am interested in utilizing my skills with cardiac patients in hospital, engaging in the latest research and
Tip number 2. Relay specific experiences. You definitely have experiences from the classroom and clinical once you graduate, and the HR manager or provider would want to hear that you're trained, prepared, and fit for the job. The key is to not exaggerate and never lie. Whenever you answer a question, use it as an opportunity to cite an example that showcases everything you've seen and done. This won't just convey that you're qualified for the position. It's a form of active listening, a way of telling the interviewer you understand what they're asking and what the work entails.
You have explained that you are looking for a nurse who is able to attend and provide urgent medical care to patients in the emergency room. In my 10 years of experience as an ER nurse, I have developed quick thinking, decisive action, and a strong stomach. I was also awarded Best Year of the Nurse Award at St. Luke's Medical Center because of my diverse set of skills and knowledge about injuries and diseases.
Tip number 3. Remind yourself that you're prepared for the work. Confidence is a tremendous asset for succeeding at your first healthcare job interview. If you answer questions hesitantly or with visible fear, The interviewer won't believe you are ready for the pressure and demands that most healthcare jobs entail. It's natural to feel nervous, but before you leave for your interview, remind yourself that you're prepared. You have the training and the experience to care for patients and perform duties your first job expects. So smile and hold your head high. Remember that you can do the job well. All you have to do at your interview is to demonstrate your competence, which starts with confidence.
Do you prefer to work alone or as part of a team?
It depends on the circumstances. I enjoy being a part of the treatment and support team, but I also like the autonomy of working alone.
How would you handle a patient who constantly complains of pain?
I would listen sympathetically to their complaints, reassure that their complaints are being heard, and make sure that I will provide the best care I can give to provide comfort.
What can you contribute to the hospital?
I offer my patients the best care I could give and make them feel like I can give them my best and provide comfort to them and understanding to be able to attend to their needs.
Tip number 4. Show perseverance and determination. Do not approach the employer as if they're easy to get. Do not be too overconfident, even if your curriculum vitae or resume looks very impressive, or if you have a lot of academic distinctions and come from a prestigious school. Show them that your skills do not only look good on paper, prove to them that you can do it in reality and that you work hard to achieve your goals. Establish yourself as a hardworking employee as soon as you meet the employer for the interview. Also, never ask the employer or interviewer about how to get bonuses, rewards, or raise. You'll only know and receive these when the company thinks you deserve it.
So why should we hire you?
I'm a highly motivated, energetic, and compassionate person, and I want to dedicate my whole life to the medical field. I'm a great communicator, and I love helping people. My previous credits and my experience of 4 years taught me the importance of patient care and developed my sense of responsibility.
Tip number 5. Do not be audacious. Attitude plays a key role in your interview success. There is a fine balance between confidence, professionalism, and modesty. Even if you're putting on a performance to demonstrate your ability, overconfidence is as bad, if not worse, as being too reserved.
You see, I'm really confident that I will easily get this job because I'm really good at interviews. I'm really good at this. And aside from this, I can also do all the things you just said earlier. I can also handle stress and extreme pressure. It's just a piece of cake.
Tip number 6. Do not speak offensive language or inappropriate jokes. No one thinks that you are going to be perfect, but if you refrain from offending people on an interview, then you will make people wonder what to expect when your guard is down and you are comfortable working there. Tell them to look at your resume if a question seems redundant. So what are your past work experiences in the medical field?
It's already stated in my resume. Please look at it and use your eyes. Just kidding.
Tip number 7. Do not be desperate. Do not approach the employer as if they're charity. Do not beg for the job because this will immediately show a bad impression to the employer and you will automatically be withdrawn from the opportunity of being selected for the job. Maintain the 3 C's during the interview: cool, calm, and confident. Be passionate of the job you're applying for and never treat it as something that arises just because of necessity. Show them that you can do the job and that you really want it.
Mom, I really need this job. When I just graduated and I need income, I need to earn back all the money I spent on my studies. I believe my skills are up for this job because of all the years I've spent studying in college. It has been a lifelong dream to help a lot of people, and I believe that this company can help my dreams turn into reality.